In order to stay healthy, we should have a balanced nutrition intake of 80% alkaline food and 20% acidic food. Spirulina is alkaline food and it can improve the acidic condition. Body acidosis affects various body organs, leading to development of degenerative disease such as brain, lungs, skin, bones, heart, and gastrointestinal systems. The period to improve the physical condition, eating habits, depending on the proportion of the food intake, acidic and alkaline. In general, one should expect at least 4 to 6 months.
There are seasonal and environmental factors which affect the growth of the spirulina. Spirulina is grown under the extensive control of optimal growth condition and the quality control of post-cultivation process based on over 40 years of experience and know-how to assure the highest quality throughout the year.
Phycocyanin is a unique blue color pigment contained in the blue-green algae, while it's not in chlorella. Phycocyanin is a potent free radical scavenger and super antioxidant. It potentiates the immune system, leading to suppression of abnormal cell development and viral infection. Russian scientists use spirulina to relieve the allergies and illness of children caused by radiation of Chernobyl power plant incident. People who are constantly exposed to the electromagnetic radiation from computers, mobile phones, and other electronic devices, as well as those suffering from acute radiation syndrome, are highly encouraged to consume spirulina. Spirulina meets the standard of necessary amino acid developed by FAO. The United Nations is confident that the spirulina is an excellent source of protein and vitamins and is effective in improving the nutritional disorders. Spirulina has very primitive but fundamental structure of the cell without hard cell wall, which makes spirulina very easily digested, nearly 90%. Essential nutrients are nutrients which cannot be produced by the body and they must be sourced from our daily diet. As most essential nutrients are consumed, broken down, lost, or excreted daily, these essential nutrients need to be replenished on a daily basis. And each nutrient is not working alone, and there are a number of biochemical reactions with a combination of nutrients taking place in a complexity of various cell functions. Deficiency of one essential nutrient may limit the absorption of other nutrients and the metabolism pathway, hence causing unnecessary wastage. Spirulina contains all 46 high digestible essential nutrients required by the body. Taking spirulina daily provides balanced nutrition and helps to maintain the 60 trillion healthy cells in the body. Vitamin B12 and iron are crucial in red blood cell production, and the deficiency of both will lead to anemia. Spirulina is a good source of vitamin B12 and iron. In fact, spirulina contains vitamin B12 2.5 times higher than the cow liver and 56 times higher in iron content than spinach.
Spirulina is food, so there is no interaction in principle with any medicine except warfarin. Warfarin, also known by the brand name Calmodin, among the others, is an anticoagulant normally used to prevent the formation of blood clots in the blood vessels. So warfarin decreases blood coagulation by inhibiting vitamin K-dependent clotting factors. Vitamin K is normally needed to make clotting factors and prevent bleeding. So despite its effectiveness, treatment with this particular medicine has several shortcomings. Many commonly used medications interact with warfarin and do some food, particularly leaf vegetable food or greens, since they typically contain a large amount of vitamin K. Spirulina also contains a vitamin K, and one who takes a warfarin should avoid green vegetables as well as spirulina. Reactive oxygen species are known to be a main cause of cataract. Several factors, including the UV light, are claimed to generate the reactive oxygen species. Alkane spirulina has antioxidative substances such as beta-carotene, which reduce a chance of free radical formation. Alkane spirulina can moderately inhibit the enzyme from decomposing the lipid, and then it can prevent the absorption of a lipid. Confirmed by the animal experiments, alkane spirulina can reduce the low-density lipoprotein and triglyceride level in blood. Hence, it reduced a risk of fatty liver formation. Alkane spirulina also provides high amount of protein in good quality, and vitamin B group and many other nutrients which help regeneration of damaged liver cells. Alkane spirulina has antioxidative activity which reduces the chance of the free radical formation at the mitochondria in the liver cells. Oxidative stress by reactive oxygen species is the second source of steatohepatitis formation. So in a research conducted on NASH, non-alcoholic steatohepatitis, experiment rats who consumed the 3% of the alkane spirulina in a diet for just 6 weeks, it was found that the levels of liver enzymes decreased significantly. So elevated liver enzymes, namely ALT, AST, and ALT, are associated with the liver impairments. In this experiment, it is shown that the ALP level decreased by 50%, AST level decreased by 24%, and ALT level decreased by 18%. So our research result indicated that there is a strong evidence that alkane spirulina helps in preventing the fatty liver and NASH.
Yes, it is. Alkane spirulina has more than 60 kinds of balanced nutrients for pregnant women during pregnancy. There are also risks of toxic substances such as dioxins polluted in food. Unborn babies are also facing those risks of intake of toxins from what mothers eat. Alkane spirulina can reduce risks of toxic substances such polluted in food absorbing into the body. In addition to detoxification, pregnant or nursing mothers absolutely require balanced nutrition to support the growth of babies as well as for themselves. So they also need good nutrition to recover from childbirth as well as to provide healthy milk for breastfeeding. Spirulina is for people of all ages. For instance, elder people can easily digest spirulina, whereas the sportsman shall receive great energy from alkane spirulina. Children can receive nutritive values for their growth, while pregnant women will get folic acid and protein from spirulina. Alkane spirulina is suitable as a nutritious food, not only for healthy, unhealthy person, but also for those who have the following symptoms: easily get tired, easy to catch cold, insufficient consumption of green or yellow vegetables, dizziness, lack of some nutrients, skipping of meals like a breakfast or person under diet. For adults, it is recommended to take 5 to 10 tablets alkaline spirulina 2 to 3 times daily, before and after meal. More than 6 months old babies can also eat by crushing the tablets into powder and mixed in the milk. Daily consumption is in principle 1 tablet for 1 year old, 2 tablets for 2 years old, 3 tablets for 3 years, and so on. Alkaline spirulina provides all 46 essential nutrients to the body. Compared with multivitamin, multi-mineral supplements, one may need to consume at least 46 types of different supplements at a higher cost and need to monitor the nutritional intake to ensure balance of nutrition. Moreover, alkaline spirulina has all the nutrients in nature's balance as a whole cell requires, not in synthetic manner. Alkaline spirulina can provide well-balanced nutrition for child growth. Alkaline spirulina can correct children's bad eating habits, enhance immunity, and reduce the chances of catching a cold. Pregnant women should consume 30 tablets a day, divided into 2 to 3 times in principle. Daily consumption for children is 1 tablet for 1 year old, but because the alkaline spirulina is not a drug, there is no strict limit. It is widely recognized that the cholesterol, low-density lipoprotein, increase the risk of heart attack, which is the most serious problem of public health. Atherosclerosis happens when excessive bad cholesterol slowly builds up and combines with other substances to form plaques, which can narrow your arteries and make them less flexible. Triglyceride is a form of fat that is made in our body. Many people with heart disease have high triglyceride levels. This can cause a heart attack, stroke, and even death. Reduction of bad cholesterol and triglyceride is another way to decrease risk of cardiovascular disease. Alkaline spirulina can moderately inhibit the enzyme decomposing the lipid and then prevent the absorption of the lipid. So confirmed by the clinical studies, alkaline spirulina can reduce low-density lipoprotein and triglyceride level in blood. We have found through the experiment that in a treatment group of the people who took 50% of the recommended consumption of alkaline spirulina, LDL, low-density lipoprotein, cholesterol level decreased by 78.9%, whilst the triglyceride level decreased by 48.6%. Alkaline spirulina contains the antioxidative nutrients such as beta-carotene, cryptoxanthin, and vitamin E, which prevent the oxidation in the cells and the formation of abnormal cell growth. Beta-carotene is an antioxidative substance. Several researches reveal that taking beta-carotene helps in the prevention of cancer. Beta-carotene is a source of vitamin A found in spirulina and is 20 to 25 times higher than in carrot. In addition, the beta-carotene can help protect the chemical substances causing the tumor, defend the chromosomal changes causing the cancer, and enhance the immune system. Since the beta-carotene exhibits high anti-cancer property, spirulina can be replaced for vegetables or fruits. In a clinical study, It is found that the concentration of the beta-carotene in the blood of the men and women who consumed the L-can spirulina was about 3 times higher than normal. Our research on immunology in Massachusetts Technology found that the beta-carotene benefit the patients who were suffering from smoking-induced cancer, such as lung cancer, throat cancer, prostate cancer, and uterus cancer. Meanwhile, the L-can spirulina is the best source of antioxidants, including the beta-carotene.
You can take L-can spirulina anytime, actually, but for the sake of argument, it is better to take L-can spirulina after each meal, with some drink to be digested together with the meal. So for the people on diet, it is better to have it before meal, 10 to 15 minutes before meal, so that some nutrients are absorbed in advance to block enzymes to digest excess fat and carbohydrate. As L-can spirulina is balanced nutrition, it should be consumed on a daily basis to replenish the body with 46 essential nutrients for optimal functions. L-can spirulina is rich in antioxidants, which are effective in the prevention of chronic disease, including abnormal cell growth. In addition, L-can spirulina also serves as energy booster, which facilitates the body Krebs cycle in the production of energy in the form of adenosine triphosphate, ATP. This boosts food metabolism and energy production in order to keep us going in a hectic lifestyle. Some people will feel more energetic after several times of consumption, as our body red blood cells turn over every 120 days. Some people would experience drastic improvement after 3 to 4 months of consistent consumption.